Hello everyone, this is Namra and I welcome you all to my channel. Today the topic which I have chosen for this presentation is Alzheimer's disease. It is a progressive and irreversible brain disorder characterized by gradual deterioration of memory, reasoning, language and physical functioning. Alzheimer's disease is becoming more and more common these days with almost 360,000 new cases diagnosed every year. Now, what happens in Alzheimer's disease is that there's a deficiency of choline acetyltransferase, resulting in loss of acetylcholine activity in the brain cortex. Now, these changes are more prominent in the basal nucleus of Maynard and hippocampus. How can one forget of dementia when it comes to Alzheimer's disease? Because Alzheimer's disease is the most common cause of dementia worldwide. Now let me show you how acetylcholine transferase works. This is acetylcholine transferase, which is responsible for the transfer of acetyl group from acetyl-CoA to choline, resulting in the formation of acetylcholine. Now, this acetylcholine is stored in the nerve index, and whenever there is an action potential, it is released into the synapse. Now, there are two major proteins which are responsible for this Alzheimer's disease. One is amyloid protein, and the other one is tau protein. Let us discuss them one by one. This is amyloid precursor protein, which is present on the neurons. Normally, it is broken down in the presence of alpha secretase, resulting in the formation of alpha breakdown product. But here in this case, it breaks down in the presence of beta secretase, resulting in the formation of beta breakdown product instead of alpha breakdown product, which is again broken down in the presence of gamma secretase, resulting in the formation of alpha beta amyloid. And these alpha beta amyloids are very much adhesive in nature and they gather up in the synapse and resulting in buildup in the CNS and which of course forms amyloid plaques, and this is the pathology of Alzheimer's disease. Now what happens is that the people with epsilon 4 allele in their apolipoprotein E are more prone to get this Alzheimer's disease. On the other hand, when the people with epsilon 2 alleles on the apolipoprotein, they are protective against this Alzheimer's disease. Now this is neuronal cell membrane with amyloid proteins. Amyloid proteins are basically transmembrane proteins, right? This is the extracellular part and this is the intracellular part. So this was supposed to be broken down by alpha secretase, resulting in the formation of alpha breakdown product. But here in this disease, it breaks down in the presence of beta secretase, resulting in formation of beta breakdown products. Now, this amyloid precursor protein breaks down in the presence of beta secretase and subsequently by gamma secretase, resulting in the formation of alpha beta amyloid. Now, this alpha beta amyloids form plaques in the synapse, and when these plaques form, they of course impair nerve impulse conduction. Now, here is the summary of what I just said. There is a signaling obstruction, but now these plaques are also responsible for like they deposit in the blood vessels too, and they increase the risk of hemorrhage. And finally, they initiate an inflammatory response. Now we have another protein known as tau protein. These tau proteins are not a part of cell membrane. Instead, they are a part of microtubules, and microtubules are of course a cytoskeleton of the neuron cell, right? So In this disease, these tau proteins, which are here, they get hyperphosphorylated. Now, when they are hyperphosphorylated, they form neurofibrillary tangles, and these proteins also result in impairment of the nerve impulse conduction. Now, here is the summary of what I just said. They are intracellular microtubule associated proteins. They become hyperphosphorylated and they aggregate and they stop supporting the microtubules, of course, because they are abnormally hyperphosphorylated, and they stop supporting the microtubules and they form neurofibrillary tangles over there, and they obstruct the neuronal signaling, and the neuronal cells ultimately undergo apoptosis. Now, these are beta amyloid plaques, and these are the normal neuronal cell bodies with nuclei. You can see this nucleus part over here, but these are the neuronal cells with neurofibrillary tangles, which are formed by hyperphosphorylated tau proteins, and they are dark purple in color. Now, there are two types of Alzheimer's disease. One is sporadic and the other one is familial. Sporadic have a late onset and they are found in the elderly, whereas familial are those who have early onset of this disease, and this disease is common in the patients who have Down syndrome. Why? Because in patients of Down syndrome, there are already 3 copies of chromosome 21, and APP gene is found in chromosome 21. So it makes sense that Alzheimer's disease is common, in fact very much common, in those who have Down syndrome. Apart from that, presenilin 1 and 2 gene mutations are found in those with familial type. Now, let us move on towards other risk factors which lead to Alzheimer's disease. Age is, of course, a huge risk factor because as the age increases, the risk increases. It is common in African American race. Family history matters because the patients with presenilin 1 and 2 gene are more prone to get this disease. Now let us come to the vascular risk factors: obesity, type 2 diabetes, hypertension, hyperlipidemia, and decreased physical activity. These factors also lead to Alzheimer's disease. Remember, it is type 2 diabetes, not type 1, because it is insulin resistance which leads to this Alzheimer's disease. Depression, loneliness also leads to Alzheimer's disease, and traumatic brain injury. Trauma to brain for more than 30 minutes also leads to Alzheimer's. There is progressive cognitive impairment, intellectual loss over there, anosognosia, which is the failed perception of patients' neurological or psychological condition. He is irritable, there are mood changes like he may be aggressive, there are behavioral changes, and there is like he might be aggressive at one time and euphoric at the other. There is psychosis. Patient might have hallucinations or delusions, and there is agnosis when patient can't recognize himself in the mirror. Of course, miserable situation. Now, this is diagrammatic representation of the symptoms of Alzheimer's. The patient is least oriented in time and space. He finds difficulty in completing his tasks. He has difficulty in problem solving. He misplaces his things all the time. There is a memory loss. There are unfounded emotions, and he finds difficulty in finding words. He's poor in judgment, and he has got agnosis. He fails to recognize himself in the mirror, and there's withdrawal from social activities. Now let us come to the management part of this disease. There is no absolute cure of this disease so far. All we can do is slow down the process of this disease. Now we have got some drugs that can slow down the progression of this disease. Number one is donepezil, galantamine, rivastigmine. They inhibit acetylcholinesterase activity, resulting in increased number of acetylcholine in the synapse. Of course, these drugs also have some side effects like nausea, dizziness, insomnia. Other drugs which we have include memantine, which is a glutamate receptor blocker, and side effects include dizziness, confusion, and hallucinations. It is said that vitamin E has a protective role against this disease, and one should also go for the control of blood pressure because there's an increased risk of Alzheimer's in patients who have heart failure. In fact, the risk is twice as compared to those who don't have this heart failure thing. Now let us come to non-pharmacological approach. We'll have to counsel the patient. In fact, like uh, it is more important to counsel the caregiver. We'll have to inform him that the patient might have these changes and he'll have to prepare himself for all these changes. Apart from this counseling part, we have to go for driving thing. We'll have to check that whether a patient is able to drive or not. In mild cases, he continues to drive and there is no problem. But in severe cases, he may have an attention deficit which results in accidents. So we will have to stop the patient from driving. Now, complications include dependence on other people, which is pathetic. Debilitation, like he's dehydrated, malnourished, and infections are most common. Death occurs in 5 to 10 years after the onset of these symptoms. Now, how can we prevent the disease? Exercising helps. We should ask the patient to, like, not the patients, but the normal people, since we are preventing the disease. So, we should have a healthy lifestyle with a good diet, quality sleep, and stress management, of course, social engagement, since loneliness also leads to Alzheimer's, and there should be cognitive stimulation. Thank you very much. If you have any queries, you can ask. Don't forget to like, subscribe, and share.